things that are going to come, there's some good things in the bill that potentially could help us. One is what we call value-based purchasing. Medicare is going to take some money from all hospitals and then reward the hospitals that have the highest quality. And again, Iowa and Mary Greeley were happy participants in that provision of hospital-based purchasing. Hospitals will also be penalized in the future if there are readmissions within 30 days. So if I come in and I happen to be readmitted for the same diagnosis, hospitals more than likely will not get paid on that second diagnosis. That will occur in 2013 outward. The other thing that the bill addressed globally that I feel very happy that Mary Greeley is already sort of meets the requirements are the tax-exempt status of hospitals being looked at very closely. In Illinois, there's been some hospitals that have lost their tax-exempt benefit. At Mary Greeley, we would have to pay about $6 million in taxes if we were a taxable income, taxable entity. We provide $28 million worth of community benefit, which is, again, 4 to 5 times what our tax burden is. In the rule, it talks about posting or financial assistance or charity policy. That's already on our intranet for anybody to see. It's also given out to every patient that requested. So we, again, are already progressive. We already meet these new federal law standards, and so that, from that standpoint, I feel good about Mary Greeley.
Okay, well, we are going to open it up to questions now. I'll have a roving microphone here so everybody can hear the questions. So is anybody bold and want to start off with the first question? All right.
Hello, my name is Lindsay Bartholomew. I'm actually a chiropractor, so I'm a healthcare provider, but not a medical healthcare provider. So this definitely impacts us as well in terms of reimbursement and everything that way. We are also a small business, and so I don't know how much you guys can comment on, but just the fact of us provide, I mean, we only have one employee. What are we doing, I guess? What are we doing basically to be able to cover our employees, and what are we going to be responsible for?
I think that's something I'll go with. For businesses with 2 to 50 employees, they're currently, and there's so many rules and regulations that are part of this law that have yet to be set up. But there will be subsidies that are, or tax credits, I should say, that are offered to employers who have an average salary of less than $50,000. And you can get a tax credit for each employee. 35% of what their premium is, you have to pay a minimum of 50% of the employee premium, and the government will pay 35% of that premium. And you got to fall into those guidelines where your average salary for the employee is less than $50,000. And I think that's for 2 years. And after 2 years, then the subsidy will go up to 50% of the premium, again, as long as you are, as the employer, providing 50% of the premium. So basically the government's paying half of that employee's premium. Again, I think that only goes for another 2 years. And you're not required, you won't be penalized, you're not fined as an employee who has 50 or more employees for not providing health insurance. But if you currently have health insurance for your employees, you can continue to offer that plan, or once the exchanges are set up, which will be 2014, then you'll be able to go to the exchange to shop for group insurance for your employees, which would create hopefully a bigger pool. More competition is the thought.
Yeah, I think I'd agree with Jolene about the impact. One of the things that people need to to understand right now, you've seen, for example, Wellmark was increasing their premiums by 18% for the individuals. And right now, smaller businesses or individuals have to pay more than bigger businesses who have more covered lives, more of a risk pool, so the insurance company doesn't have to worry that somebody will get cancer and spend $300,000 on their care. So the bigger the pool of people, the bigger the business, generally the better their rates have been. So this new law will mitigate some of that bad experience for some smaller businesses or individuals. They won't have to pay so much, and then some of these people that buy individual policies will be getting something that's affordable, because if they had a pre-existing condition now, they might not even be able to afford those individual policies. You know, people don't realize that only 6 to 7% of Americans buy individual health care policies. Almost all of us get our health insurance through our business. And our businesses generally pay for about 3/4 of our health insurance premiums. So most of us don't even know that we're paying $10,000 for a family policy or $5,000 or $6,000 for an individual policy. Our businesses know that. The bigger businesses definitely keep track of what their costs are. But I'd agree with one of the other comments Jolene made. The biggest problem in healthcare now is the cost, and how can we all afford all of this. But I would like to make a little comment about what Mike had said too. We know that both Medicare and health insurance that's run by private insurance companies is going up at an unsustainable rate. And Mike can attest to this fact that, again, we know that there are huge variations in costs or expenditures from region to region, state to state, and many of you have probably heard me complain about this before, but healthcare does not have to be so expensive, and we can simply take the Iowa example. Compare us to Miami, Florida, or McAllen, Texas. In Miami, Florida, they're spending $16,300 per patient per year for Medicare patients. Per patient per year, $16,300. Right here in Story County, Medicare is spending $6,300. In other words, $10,000 less per patient per year. And just like Mike said, we have some of the highest quality care here in Iowa. We get paid as physicians in hospitals some of the lowest rates in the country. But yet we have more value for our health care. So this law does have some stipulations, some projects, some demonstrations that will pay for value. And one of the greatest parts of this bill that I got excited about was there is a proposal to pay for value. In other words, if we want higher quality care, if we want more cost-effective care, not more expensive care, more cost-effective care, higher quality, more cost-effective care, more value in health care, this bill is going to go a long way to doing that. So if your physician is going to be rewarded for keeping you healthy and out of the hospital, that's going to save us all some money. So why don't we reward our physicians instead of like those Miami doctors who do too many procedures, too many hospitalizations, too many days in the intensive care unit. If we change the payment system to reward value to the patient, we'll be a lot better off.
Do you have a comment, Mike, on the question? Okay. We have a question over here.
Mine was just a little follow-up to that. As an employer, will I be required to cover part-time employees, and or will I be required to cover my employees' families?
The way the law is written right now, the small business person with 2 to 50 is not required to provide health insurance for their employees. If you currently do, you can keep your plan for now, and then in the future, if you go to in 2014 when those insurance exchanges are set up. Does everybody know what that's about? Or should I go into a little more detail there? By 2014, each state is required to set up what they call an insurance exchange, where private companies will come in and they'll compete in the marketplace by providing a pricing for 4 different plans. It would be like the platinum, the gold, the silver, and the bronze. Thank you. And those 4 plans, each company that wants to compete in this insurance exchange will present those proposals. There will also be, at that point, if someone